welcome to our latest interview here at Top Doctors. Today we are very pleased to welcome Dr. Steven Joseph, who is a leading general practitioner and psychiatrist based in Barcelona at English Doctor Barcelona. Hello, Dr. Joseph.
Hi.
Thank you for joining
Hello.
us today. Would you like to say a few words about yourself?
As you said, I work here as a GP and I have a special interest in psychiatry. And I've been here quite a long time in Barcelona, about 13, 14 years. We've recently moved to a great location down by the Olympic Port area, which is exciting and pleasant. I have two beautiful daughters in my personal situation space, and I think looking forward to talking about schema therapy today.
Yeah, lovely. Thank you. So we are, as you mentioned, going to talk about a really fascinating type of therapy today, schema therapy. So to get started, could you tell us what schema therapy is and what the aims of it are?
Let me start with what it is, okay? Schema therapy has two different components, okay? And it's a very structured form of therapy. Schema is one component and the mode is a second component, okay? The schema is an extremely stable and enduring unconscious pattern. It develops during childhood. It's elaborated throughout adult life. The schema holds important beliefs and feelings about oneself, which is associated with certain behaviors. Now, schema therapy will identify various schemas, obviously. There are schemas, for example, called emotional deprivation, mistrust and abuse, abandonment, instability, and which are linked to characteristic beliefs and feelings. Okay, so let me give you an example. With emotional deprivation schema, it's linked to a belief. Somebody holds a belief that their primary emotional needs are not going to be met. That means they're never going to feel nurtured, never going to feel guided, protected, and receive empathy. Now, there are about 18 different schemas, okay? The second component is the mode, the schema mode. This is a reaction, the individual's reaction to your schema, okay? A schema mode is it's attention-focused, it's immediate, it's an activated state, and it's triggered by an emotional upset happening in the person's life. Now, there are different schema modes. I'm not going to go into details, but there are types of schema modes known as the child modes, the parent modes, and the coping modes, okay? I mean, that's just an overview, okay, of the schemas and the modes. And what makes schema therapy different to other therapies is that it's very structured and it focuses on these modes, which are active during each therapy session, to enable the client to begin to understand their personality function. Okay, I'm moving towards the aims of schema therapy, which is your second question. Okay, if I talk about the aims of schema therapy, is that okay?
Yeah, perfect. Thank you.
Is to deserve this dynamic interaction between the patient's schemas, which are the enduring unconscious patterns that they carry, and their schema modes, which are the attention-focused immediate reactions during the session. And the aim is to weaken the underlying schema, to meet the unmet emotional needs of the patient or client in the sessions. We seek to promote the healthy adult mode and to deal with the presenting mode states, the patient's experiences in the session appropriately. An example, a vulnerable child mode in the session, a therapist would be required to show empathy, to make the patient feel safe with the therapist. That's just a brief example. So there's a very dynamic interaction between two different processes, between the schemas and the modes in schema therapy, which is very powerful, very structured, and I think patients appreciate that it's guided and structured, and it allows them to follow it in a clearer way.
All right, thank you for clearing that up and giving those examples. Given all of that, who might benefit from this type of therapy?
Schema therapy is quite broadly researched, and there's a lot of evidence to show, which is quite high quality research and from trials, that it's certainly useful and works for patients with certain types of border personality disorder. I know that there are sort of emotionally unstable or borderline personality disorder patients that can benefit from this. So then there are patients who just have chronic recurring psychological problems and distressing symptoms since their childhood, and they don't necessarily know what the diagnosis or what the problem is. And certainly those patients will benefit. Patients with sort of chronic anxiety or recurring chronic depression will certainly can benefit from this. And patients with issues to do with substance and alcohol misuse can also benefit from schema therapy.
Okay, so quite a wide range of people.
Yes,
okay.
For sure.
You have touched on this briefly, but my next question was going to be about how schema therapy works. So how does the sort of structure of the therapy, how does that actually translate into helping people?
I mean, again, schema therapy is quite complex and requires a degree of skill, and I can't go into all the detail in such a short space of time. But what I can say is that there are 4 different approaches to treatment per se. We call it emotive approaches, interpersonal approaches, cognitive and behavioural approaches, and we use those in a mixed way depending on where things are in a session. So, for example, the emotive technique, we ask our patients to use imagery or memories to help them recreate the feelings of a schema state or a schema situation or potentially a mode. So then we ask the patient in those situations to really to express the feelings in a particular memory. So again, I don't want to go into lots of detail, but that is one approach to allow patients to start to understand where the feelings are coming from and to help them put distance between themselves and the actual feeling that they carry.
Brilliant. That clears that up. Thank you. Another question people might have if they're watching this video and they're thinking maybe this type of therapy could benefit me, what could they expect from their first session?
Well, obviously, we take a full history, which would be psychiatric, psychologically based. We're going to look at how current events in their life, and it's very focused on the current events in their life, how that can relate to childhood events, to see that there may be a repetitive pattern of feelings and behaviors and thoughts, which can be understood through schema therapy. We also use questionnaires. We would use a schema mode inventory, the young parenting inventory, and a young schema questionnaire, which again, and it would take 2 to 3 sessions to put all the information together. It's important that a patient feels they understand the process of assessment, because they need to feel that it relates to their difficulties personally and it makes sense for them.
Absolutely. And my final question would be, is this sort of ongoing treatment that would take place over a longer period of time, or can it be in some cases quite short term?
It can range. It can be short term or long term. I mean, invariably, I see mostly people who are involved in the longer term processes. So we usually need weekly treatment, certainly at the beginning. It can be even more than that, depending on circumstances. It can be fortnightly treatment, okay? Or it can be, we can offer a block of treatment. So, for example, 1 or 2 months block and then leave it. That's certainly possible. And treatment can range between up to 6 months to, several years for people with a more severe end of the spectrum, where they have very difficult psychological disturbances.
Thank you so much, Dr. Joseph. Even just in this quite brief interview, you've given a really, really interesting and a good impression of what this type of treatment can offer people. And I think everybody's going to find this video really interesting. Thank you so much. Can I just also mention that if you are interested in learning more about Dr. Joseph, or you think you could benefit from schema therapy or some other type of treatments, please do have a look at his Top Doctors profile. It's on the Spanish area of our website, so Top Doctors España. Thank you again, Dr. Joseph.
Thank you. Nice to meet you.
Nice to meet you.
Bye-bye.
Bye-bye.